Hi, I'm Dr. Hess and I'm an ophthalmologist. Eyelid eversion is an important clinical skill for all healthcare workers, since foreign bodies can get stuck under the lids, and the best way to visualise and remove them is to evert the eyelids. In this video, we'll demonstrate the best technique to evert eyelids and sweep the tarsal conjunctiva for a foreign body. You'll need sterile cotton tip applicators, hand sanitising gel, topical anaesthetic drops, and normal saline or sterile water. Lid eversion can be performed on a slit lamp or in an examination chair. Today we'll demonstrate the latter. So start by explaining the procedure to the patient and get verbal consent. It might be slightly uncomfortable, but shouldn't be painful. Perform hand hygiene, put in topical anaesthetic drops in order to make the patient more comfortable. So first we'll evert the lower lid. Here, simply exert downward traction on the lid using your thumb or the cotton tip. Ask the patient to look upwards, press firmly about ½ centimetre below the lower lid margin. You can then inspect the inferior fornix for a foreign body or other pathology. Everting the upper eyelid is trickier because of the levator muscle. So here we use the tarsal plate, which is the scaffold of the upper lid, to our advantage. First, dry the eye with a tissue, and then have the patient tilt their chin up, look down with their eyes. With the thumb and index finger of your non-dominant hand, grasp the lashes at the centre of the lid and gently pull straight down. Make sure you've got a comfortable but firm grip, and this should expose the horizontal skin crease of the upper lid, which is the landmark that you want. With your dominant hand, place the cotton tip at the centre of the skin crease. This creates a fulcrum around which you can hinge the tarsal plate in the upper lid. You can now rotate the lid around this fulcrum in a single motion. Once it's everted, hold the lid in this position using a thumb or finger. You can now inspect the upper tarsal conjunctiva and sweep it if needed with a moist cotton tip. Roll the cotton tip over a foreign body, as this is more comfortable than rubbing it on the foreign body. After you finish your examination, simply release the upper lid, ask the patient to look up, and this will flip the lid to its normal position. So in summary, start by positioning the patient comfortably, get verbal consent, wash your hands and use topical anaesthetic. For the lower lid, just create downward traction. For the upper lid, grip the lashes, use the skin crease and rotate around the fulcrum. Perform a conjunctival sweep if it's needed. Some tips for lid eversion include using a hinging or rotating action. A common mistake is to pull straight up, which often doesn't work and can be painful. Don't perform lid eversion if you suspect a bad eye injury, such as a ruptured globe. Lid eversion here will actually put pressure on the globe, which can exacerbate the injury. And finally, I recommend using anaesthetic drops for lid eversion because it makes the patient more comfortable, it's perfectly safe to do, and if there is a foreign body, it allows you to remove it without causing further discomfort. Thanks for watching this video. For more eye videos, visit eyeballsmadeeasy.com, and if you have any questions, feel free to get in touch.